Hello everyone, my name is Ignacio Sarasua and I would like to present our work TransforMesh, a transformer network for longitudinal modeling of anatomical meshes. Patients which progress to Alzheimer's disease experience an accelerated shrinkage of their hippocampus in comparison to healthy controls. Being able to model and predict these changes is of crucial importance for a better understanding of the disease and its early diagnosis. Studies like ANDI collect longitudinal and multimodal data across a population and measure the cognitive decline. However, one of the main issues of this type of studies is that not all the patients show up to every follow-up session or they abandon the study early. This leads to incomplete trajectories and longitudinal imbalance in the data. In order to tackle this issue and model longitudinal trajectories of hippocampal shapes, we propose TransforMesh. Our method takes as input hippocampus meshes. These are encoded using a mesh encoder based on SpiralNet++. The embeddings generated by the mesh encoder are input into a transformer network after a positional encoding step. The output from a transformer encoder is passed to a mesh decoder, which generates deformation fields that are applied to reference shapes to obtain the target meshes. The L1 norm is computed between the predictions and the inputs and is used to train the model in an AutoEncoder manner. In order to account for the missing shapes, we use the reference shape to generate the embeddings. However, these are ignored by the transformer network by modifying its key mask. In addition, they are not considered when computing the total reconstruction error. We define three reconstruction experiments. First, we explore the capabilities of our network to predict intermediate shapes using past and future representations. We remove one of the intermediate shapes from the input and compute the reconstruction between the model's prediction and the real one. Likewise, in the extrapolation experiment, we extract the last available shape and predict it only using past data. For the last experiment, we input only the reference shape into the network and observe its ability for reconstructing the whole patient's trajectory. In order to study the effect that the amount of self-attention blocks have in the final performance, we train three independent models which have 1, 3, and 12 blocks respectively. In order to measure the effect of temporal modeling, we define a baseline method based only on multi-layer perceptrons, which are proportional to the size of the sequence. Since this method does not take into account the order of the sequence, it only models this spatial dimension. In addition, for putting the reconstruction error into context, we measure the error induced by the mesh encoder and decoder blocks by inputting the target shape and comparing it to the output. Our results show that our proposed method outperforms the multilayer perceptron-based method, even for the version which has less trainable parameters. In addition, the yielded performance is comparable to the mesh encoder. We are also interested in analyzing the capabilities of our method to detect structural anomalies on patients that are in path of developing Alzheimer's disease. We train our model only inputting patients with mild cognitive impairment across all the follow-ups. In testing, we added patients which at some point in the study developed Alzheimer's disease. When computing the difference between the input shapes and the predictions, we observed that the patients that develop Alzheimer's disease show a much higher reconstruction error in areas that have been correlated with previous medical findings, like the medial part of the body in the subiculum area, the lateral part of the body in the CA1 area, and the inferior part of the hippocampus head in the subiculum area. To conclude, in this work, we have proposed the first transformer-based method to analyze longitudinal shape trajectories. Our results show that combining temporal and spatial information is beneficial when predicting missing shapes. In addition, TransforMesh is the first method used to detect anomalous trajectories on patients that are developing Alzheimer's disease. We are currently exploring how to integrate recent advances in transformers into our work. Thank you all for your attention and make sure to check our full paper.